Assalamu alaikum to all of you. Myself Marwa Bibi from BS Biochemistry Department, and today I'm here to present the topic which is Gynema. The content of my presentation mainly include its introductions, its working, its uses and effectiveness. In uses and effectiveness, we mainly covered its cons and cons, and the last one is its precautions and warning. In which case we will avoid to use Gynema. So, as far as Gynema is concerned, Gynema is actually a shrub. It is a wood climbing shrub which is mainly present or comes from the forest of India and Africa. It's being used medically in Ayurveda, and it is very common name which we often hear in India, as it is an Asian Indian medical practice for over 2000 years ago. Chewing on the leaf of this plant can temporarily interfere with the ability to taste sweetness. It's generally considered as safe for adults to take. Gynema has very wide range of uses and or advantages as far as concerned. It is mainly used to lower the blood pressure, reduce the amount of sugar absorbed by intestine, stimulate insulin release in the pancreas. It is also sometimes used to treat stomach problem, constipations, liver disease, and water retention. Actually, we can talk about Gynema as a plant. So this is a plant which require full shade to grow appropriately. Water the planting site approximately 3 times per week to keep the area moist but not soggy. Gymnema will not tolerate wet feet but will grow best if the soil is slightly moisture. Regulate your watering schedule by your local weather conditionings, and these are all the conditions how to grow the Gymnema. As far as its working is concerned, Gynema mainly consists of substance to decrease absorption of the sugar from the intestine. Gynema may also increase the amount of the insulin in the body and increase the growth of the cell in the pancreas, which is the place in the body where insulin is made. Means that pancreas is a place where the insulin is made. As far as its uses and effectiveness is concerned, there is not enough evidence to definitely prove Geneva effectiveness for blood sugar or balancing or diabetes. However, multiple studies have shown potentials. A 2001 study found that 65 million people with a high blood sugar who took Ganyma leaf extract for 90 days had or lower levels. Ganyma also appeared to increase glycemic control in people with 2 diabetes. The study author concluded that Ganyma could help prevent diabetic constipation in the long term. Ganyma may be effective due to its ability to increase insulin secretion, according to the review in a journal of the clinical biochemistry and nutrition. This in turn helps lower blood sugar level. As far as the use of dynamic in diabetes is concerned, early research suggests that taking a specific Gynema extract GS4 by mouth in combination with insulin, a diabetes medication can enhance blood sugar reduction in a people with a type 1 and a type 2 diabetes. In diabetes treatment, typically focus on the two goals, either to control the blood glucose levels and preventing complication. Treatment plans, which often include medication and lifestyle changes. Most people with type 1 diabetes and some with type 2 diabetes will need to take insulin via injection or insulin pump. So, as far as the role of vagina in diabetes is concerned, it is very effective in treatment of the diabetes. As far as the use of the Gynema is concerned, in a reduction of the weight, so Gynema extract has been shown to aid weight loss in animals and humans. One 3-week study showed reduced body weight in a rat given a water extract of Gynema. In other studies, rats on a high fat diet that were fed a Gynema extract gained a less weight. So, by blocking sweet receptor on your taste bud, Gynema may cause you to eat fewer sweet foods and consume fewer calories. A consistent calorie deficit can result in a weight loss. And it is also used in the metabolic syndrome, stimulating digestion, malaria, cough, and snake bites. It also have a lower blood sugar level. Gynema may also contribute to a favorable insulin level by increasing insulin production. Gynema role in insulin secretion, cell regeneration may also contribute to its blood sugar lowering capabilities. Higher insulin level means that sugar is cleared from your blood at a faster rate. If you have pre-diabetes or type 2 diabetes, your body tends to not make enough insulin or your cells become less sensitive to it over time. This result is consistently high blood sugar level. Gynema may stimulate insulin production in your pancreas, promoting the regeneration of the insulin producing islet cells. Help this can help you lower your body or blood sugar level. Gynema also improve cholesterol and triglyceride level, reducing heart diseases risk. While Gynema gets its fame from lowering blood sugar level and reducing sugar craving, research show that it may also influence fat absorption and lipid levels. In one study, in a rat on a high-fat diet, Gynema extract aided weight maintenance and suppressed the accumulation of the liver fat. Also, it is involved in reducing the heart attack diseases risk. As far as special precaution and warnings of using Gynema is concerned, so Gynema role so, as of now, there are no significant drug interaction known to interfere with Gynema. It may change the effectiveness of other medications that lower blood sugar, but there is no solid evidence of this yet. It is crucial to let your doctor know before you begin taking this or any supplement. Gynema is not a substitute for diabetes medication, while lowering high blood sugar is generally a positive thing in people with diabetes. Lowering it too much can be extremely dangerous. If you're going to take Gynema to treat diabetes, do so under the doctor's supervision. Check your blood sugar level more often until you know how it affects your body. Also, check every time you increase the dosage. And as far as the use of the Gynema is concerned during your pregnancy or breastfeeding, so a woman who are breastfeeding or pregnant or planning to become pregnant should not take Gynema. You should also stop taking Gynema at least 2 weeks before a surgical procedure to avoid any negative reactions. And also avoid using Gynema during or before a surgery. Gynema might affect the blood sugar level and could interfere with the blood sugar control during and after a surgical procedure. So stop using Gynema at least weeks before a scheduled surgery. Thank you so much for your attention. This is all about Gynema. I hope so you enjoy the presentations. Thank you. Thank you so much. Allah Hafiz.